And your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. Our number to reach us is 954-717-7027. I am your host, Louise Gomez, and welcome to the show. Tonight, we are excited to introduce everybody to Dr. Emlyn Lewis. And the direct number to reach him is at 239-288-0840. He is at bestcarefamily.com. That is the website, www.bestcarefamily.com. And the address is 2718 Lee Boulevard, Suite B as in boy. That's in Lehigh Acres, Florida, 33971. Welcome to the show, Dr. Lewis.
Good evening. It's a pleasure for me to be here today.
Absolutely. We're so excited to introduce you. I know you are a family medicine physician with a fellowship in functional medicine. Is that right?
Yes, ma'am.
Excellent. And Dr. Lewis, if you can let me know, tell us a little bit about your background and where did you go to school and what made you want to become a doctor? A little bit of history on your past.
Yes, Ms. Gomez. Again, my name is Emlyn Lewis. I'm basically from Haiti.
Nice.
I went to medical school a lot of years ago, so it's been a long time. So the reason why I went to medical school, number one reason was my passion to help people. So I come from a place where we don't have much, and since a young age, I used to go and help people there, and I say one day I want to do it in a professional level where I will be able to help everybody, no matter your race, your color, how poor you are, rich are you. And that's the main reason why I went to med school.
You know, I love hearing that when you said, you're passionate about helping people. To me, that is such an admirable quality because first and foremost, you really want to help the person. So I know anybody listening right now, really as a patient, as the end user, we really want, bedside manner. We really want to know that the doctor that we're seeing really is passionate about helping us. So I want to thank you for following your dreams and your passions and pursuing that,
Yes, that should be the main. Yes, every doctor should basically have that as a priority. Because you
That's
went to
right.
school, it should be to
Right.
help your patient and basically make sure you make an impact in their lives.
That's right.
So this is a priority for us at Best Care, where all the providers basically have that same mentality, where the first priority is to make sure our patients are not only feel comfortable, but get the help that they need
Right.
and get the best care that they deserve.
So how many providers do you have at Best Care Family?
At Best Care Family, we have 7 to 8 providers right now.
Nice. Oh,
Yes.
wonderful. That's amazing.
Yeah, that's great.
And what let me ask you this. What made you want to get your fellowship in functional medicine? Because I am a huge proponent for functional medicine because I know that when I hear that word, fellowship in functional medicine, I know that you are looking to get to the root cause of the issue. Is that right?
You are very smart, Miss Gomez. That's that's exactly right. So I've been a doctor for a long time. So like I say, I graduated in Dominican Republic in 2000 in 1990. Okay,
Nice.
1990, a long time ago.
Okay, plenty of years.
It's a lot of years. So I've been practicing conventional medicine for years, and the last three to 4 years, I say I want to make, I want to practice like a better medicine,
Nice.
where I want to find out the root cause of problem. What bring my patient here? I want to find a cause instead of when you come, I say, okay, get that medication and go. I say
Right.
I need to do something better. So I went to a conference one time and I see in conventional medicine and integrative medicine conference, and this is when I decided, I say, no, I need to get better for my patients. I need to get better information. I need to provide better care to my patient. That's the reason why I went to functional integrative medicine.
I'm curious, was that an A4M concert conference? A4M conference?
Yes.
Yes, I
Yes.
worked with them. I worked with A4M for many years, and
Wow.
that's where my passion for learning and sharing functional medicine. I mean, I've always had the passion to learn about it, but when I worked with them, I
Wow.
knew that doctors needed, in my opinion, I felt that everybody needed to learn about functional medicine, to learn about the root cause, not just like, all right, you have high blood pressure, let's just
Here's
give
a
you
pill.
medication. No, let's get to the root cause.
Yes, ma'am. You're very smart. So that's exactly what it is. So after so many years, and okay, you come here, okay, get the labs and medication. I say, man, this is a better way to get to
Right.
the bottom, to get the cause, and I think you become a better provider when you get that background.
Right. So
Yes.
I'm curious, do you order any type of different types of lab work to be able to help the patient, the end user with their lab profile?
Yes, so there's a lot of labs that you have to order, but with our system, most of our patients can afford to pay those labs.
Okay.
You know, so the one that can, we order them, they do them, but that's why we working on some in the process to basically see how we can help people to get those very important labs. But yes, you order them to the for the people that can afford them because the insurance doesn't really pay for most of those labs. So
Wow.
after certain years, you get some experience. Some patients come, you don't have to order a lot of tests. With
Right.
few tests, you can get to the bottom cause of what the patient having.
Right.
But generally, you have to order a lot of specific labs for these
Right.
patients.
I'm loving this conversation because it's reminding me of, if I had to order any specific lab work, what would you say if I said to you, Dr. Lewis, I really need to order some labs. I don't know, I'm paying you, I don't have insurance. What type of labs would you recommend? If you had to take the top, let's say 5, would it be maybe detoxification through our
Yeah,
pathways? What would that look like?
it depends on the symptoms of the patient. So you
Sure.
cannot just order a bunch of labs for patients. So you come to me and you tell me your
Yes.
symptoms. I need to find out what is your symptoms, what
Okay.
I'm thinking that you have, and that's gonna based on what type of labs I'm gonna order for you. So your question on where to get those labs, that's one of the difficult things. There's few labs and like in Florida, there's few labs that basically do those functional tests. So I have to tell you, I have to reach to the labs first, and then see if they when and how they will be able to do those labs for us. So the problem here, we don't have much labs. Here we only have LabCorp and Quest and a few other
Right.
labs. So
Right.
and so functional medicine labs, we don't have many. So we have to contact the labs and then order the test for you based on your symptoms, what you describes to me. Because there's so many tests, it's
Right.
like symptom specifics. But most of the doctors will order what we call see if you have toxins, if you're exposed to antibiotics. So
Right.
there's certain labs that are basically specific for every symptoms, but depends on your symptoms. That's what we order.
That makes so much sense. So, like, if I
Yeah.
said to you, you know what, Dr. Lewis, I have eczema. I have these challenges, with the skin or whatever. So, you would know the specific labs to order so that you can prescribe the right to get to the root cause of what
To
the
the root cause.
ailment. would be.
Yeah, so you listen to the patient and you tell the patient, okay, this is the labs I want to order. That's probably what they might cause you. They might cost you. So
Right.
again, the patient will tell you, okay, I will tell you exactly. I will want to order these three or these four tests.
Right.
Okay, but depends on how much can you afford. That's gonna that's gonna lead to what test I order for the patient.
Okay. So
Okay.
when they're initially going to see you, I know you mentioned you do accept some type. Can you let's go over the type of insurance that you accept at your practice.
Yeah, in a practice, we like the Medicare, Medicaid.
Okay.
We some of the Medicare plans we take mostly United Healthcare. We take Simply. We take
Nice.
Oscar. We take Blue Cross Blue Shield. So we
Nice.
take most of the major insurance that basically in the market. But again,
Mm-hmm.
remember those insurances doesn't pay for those labs.
Right.
So again, after certain years, that few tests that LabCorp of course can perform. We can try, for example, they can do like if we want to if somebody has been exposed to mold, by example,
Right.
you can get a mold panel from Quest, but there's other toxin tests you can't order them from those labs, so you have to get a specialized labs like a functional medicine labs, which we don't have much in Florida. I think we only have like two.
Mm-hmm.
So most of our patients with Medicare and Medicaid basically can't afford those labs, and LabCorp doesn't perform them. So that's kind of a
Yeah.
separate things for like the mostly for
I got
private
it.
patients.
Sure.
So
Makes sense.
yeah.
I wanted to go back to your background a little bit because I was looking at your bio and I know that you, prior to working with Best Care, I think you were also working with different demographics in different arenas. Can we speak into a little bit about what you did? I think you were at the health department and a couple of other locations. Do you want to share with us?
Yes, like I mentioned earlier, I have a lot of years of experience. So
Yes.
I works basically everywhere. We we works in correctional facilities for many years. We work for the health department. We work for private clinics and hospital in Puerto Rico. So we have a diversity. We basically works in most of this medical settings. So
I love that. And
yes,
you know why I love that, Dr. Lewis? Because that shows me that you have experience with such a wide variety of demographics and you deal with so many different types of people and so many different types of ailments. So for
Ye-
me, that's really refreshing to know that you have that experience.
yes, we basically seen it all. We works basically everywhere. So now we full time for best care. So we focus on best care, but we
Right.
basically been and we do like we used to do like traveling doctors also. So
Oh, you did that as well. Okay.
so we used to be in the road for like 3 to 6 months in a hotel and go work. So and we
That's
basically
impressive. That's
it's
impressive. That takes a special type of person to be able to do that.
exactly. So that's mean that's give you all the experience that you need to basically provide the
Right.
compassionate care for all type of patients.
Yes. Yes. And what about your senior population? Do you have also a lot of experience with our senior population? I know you said you accept Medicare. So do you have
Exactly.
share with us about that?
Oh, I used to work. I forgot to mention. I used to work in a nursing home.
Oh wow, that's
I used to work.
amazing.
I used to work in nursing home with hospice in it. So provide care for these people that basically really need somebody that really care. So when you work with somebody that can't, most of them basically, especially in hospice, so these patients really you need compassion to work with them.
Yes.
And also at
Yes.
Best Care, we see Medicare patients. So most of our population, by example, our clinic and in locally, we have a lot of elderly there. So how we help them, we see them at the clinic, but the one that basically doesn't have a car that can't come to the clinic or that homebound, so we go to their home and see them. We send a nurse to their home to do labs for them, and we go
Wow.
personally and take care of them. So we try everything to make sure that they get the quality care that they deserve.
This is so impressive, Dr. Lewis. We have a quick commercial break. We'll be right back. We'll continue this great conversation that we're having. We'll be right back.
Fantastic. All right.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back to our show. We have Dr. Emlyn Lewis. He is with bestcarefamily.com. The phone number is 239-288-0840. The address is 2718 Lee Boulevard, Suite B as in boy, Lehigh Acres, Florida, 33971. Welcome back to the show, Dr. Lewis.
It's a pleasure.
Absolutely. I'm so enjoying this conversation because what I'm really enjoying the most about this is you have all this experience from all these different, traveling and with seniors and you worked in nursing homes and you worked in,
Jails.
in
You work in
jails.
prison.
You just everything, and then you bring your expertise and you just bring it right to your practice. And
Yeah.
they're so lucky to have you. And then on top of it, you've got your fellowship in functional medicine. And I know you had a great training. I know that because I know you had great
Yes.
learning with A4M, and I know the types of doctors and the quality of learning that you had. So I'm so
Yes.
happy to hear that. And they're so lucky to benefit from all of that. I was going to ask you, what would you say is a common issue that seems to come up at the practice? Is it high blood pressure? Is it cholesterol? Is what would you say is something that repetitively shows up, and what can we do about it?
Yes. So we have several practices, and it depends on the locations.
Sure.
But generally, in this country, the most common condition people come with is high blood pressure, and mostly
Is it?
diabetes.
Really?
Yes. The three diabetes, high blood pressure, and cholesterol are the three most common one that
So high
all
blood
patients-
pressure, cholesterol, and what else?
and diabetes
And diabetes.
sugar.
So
Yes.
this is my question. How much of that can we, as the patient, how much of that can we prevent or work towards reversing? Like, what do you suggest?
Exactly. Remember, there's something that says we are what we eat.
Yeah, we are what we eat. That's right. That's
So at
absolutely
F1,
right.
that's one thing they I was taught that the most important thing, you have to educate your patients to get a healthy diet and exercise. There's one thing most of my patients now, what I try to do, the first consultation, I try to explain to them and try to put them in what we call an anti-inflammatory diet. If you eat good, you remove all those things that cause inflammation, because the most common cause of most disease is inflammation. So
Yeah.
if the doctors understand that, to try to explain to a patient, educate them to get a healthier lifestyle, eat better, decrease inflammations. A lot of these diseases, we don't have to get kill them with pills. So the last 3 to 4 years, I try to integrate these
Yes.
these routine in my practice. So we educate our patient to try to live healthy. Unfortunately, there's some of the clinics that we have, the population are very, underserved. They don't have the
Yes,
mean,
of
so
course.
it's more difficult to tell the patient,
Sure.
you know. But again, if you try to decrease inflammation, you try to educate your patients to try to stay healthy, stay away from smoking, stay away from alcohol, explain to them what certain foods can do to them.
Right.
These simple practice will help decrease a lot of a lot of those diseases that are killing us in this country.
That's right. So we,
Yes.
as the end user, as the consumer, as the patient, we also cannot be a victim to this. We can say, all right, I can participate in being healthy. I can change my
Yes.
diet. I heard of it. I think I heard Dr. Mark Hyman call it inflammaging, right?
Inflammation.
Like
Oh, yes,
it's
yes.
an
You know Dr.
aging, right?
Harman. He's the best. He's for
Yes,
me.
yes.
He's one of the best. He's
Yeah, and
basically
I've heard when I heard that, I said, "Wow, that triggered me to say I don't want to age quickly." So, like you said, eating an anti-inflammatory diet. What are some good foods would you recommend that are anti-inflammatory that we can share with our audience that maybe they can begin to incorporate into their diet to make those small changes? What would you suggest? A couple of good foods to.
the most common thing is to try to remove the one that cause inflammations in your diet. Like you stay away from gluten, you stay away from dairy product, you stay away from processed foods. You
Right.
try to take away all these ones, and you implement most of the. You get some pre-probiotics daily. You get some CoQ10, some omega 3, and then you get more veggies, vegetables in your diet. When you do this, you remove the one that causes inflammations, and you get the CoQ10, the omega 3, and you get some magnesium, because one of the most people in this country are deficient in magnesium. You add those things to your diet, and again you exercise, you're gonna see the difference. So you do those simple steps to decrease inflammation, you're gonna start feeling better very
I have
quickly.
a question about magnesium because to me it's so confusing because we have magnesium L-threonate, magnesium glycinate, magnesium. I don't know. There's so many different
Magnesium
types of
nitrate.
magnesium. So what would be a good magnesium to recommend to the audience?
You take magnesium citrate, but again, if you have high blood pressure,
Yeah.
chelated magnesium is the best one to take, because that shows to increase vasodilation, to help blood flow better. So it depends on most people just
Oh,
take
okay.
magnesium citrate. Yes,
Okay.
but my patient with blood pressure,
Which is the one good for high blood pressure? Magnesium citrate?
no, chelated magnesium.
Oh, chelated magnesium. Got it.
Like
Chelated.
all your patients with some patient come to you, like by example the first time the blood pressure is high. So
Right.
you can't diagnose someone with high blood pressure in the first visit. So again, like I say, you're going to explain to the patient, do lifestyle modification, but most of these patients, I tell them you take some chelated magnesium. And some patients, you can add something called L-theanine, and you tell them to take these two. Those will help basically with the blood pressure without putting down blood pressure.
Interesting. L-theanine, you said?
Yes,
Nice.
and
Okay.
chelated magnesium.
Chelated magnesium. Wow. Okay. I love that you also recommend a good diet. You recommend supplements. What else do you recommend? Eating well. What about exercise?
No, that's lifestyle modification and include those things, diet and exercise. So it is very good that you do at least 2 3 days a week. Everybody's busy in this country, but if you dedicate 30 minutes at least 3 times a week, this is fantastic. You decrease it,
Okay.
you will that will help with the blood pressure. That will help with for you to lose weight, because in diabetes we don't have time to really talk about the different types of diabetes, but there's basically two type. People with type 2 are mostly obese. They have resistance to insulin. So most of these people, if you lose weight, so there's a lot of things you can take care of. So exercise is fundamental to well-being.
Right. Exercise is fundamental to well being. I love that. So, diet, exercise. What are some of the other, I call back to basics, right? Everything are great grandparents taught us. What else?
They will tell you stop smoking,
Right? That's right.
and they will tell you decrease your alcohol intake because high blood pressure. There's high blood pressure can be essential and secondary. A lot of people have secondary hypertension. In younger people, alcohol is one of the most common cause of secondary hypertension. So, if you quit the smoking and you decrease alcohol intake, this is a very good thing when you do it for your lifestyle modification. Good diet, exercise, decrease those food that I say that increase inflammation. You'll be in a good place.
Excellent. Dr. Lewis, this interview has gone by so quickly. I'm so impressed and I'm so grateful. We literally have like 2 minutes, little less than 2 minutes left before the interview is about to end. What would you suggest, or maybe you want to leave us with a feel-good story, whatever you're thinking, the last couple of minutes, what would you like to share with our audience that's listening? Please do. Please share.
Okay, so first of all, I want to thank you for having me here, and
Of course.
we wish to get another interview in the future where we can talk
Absolutely.
basically most about functional medicine. I see you love that very well.
Yes.
I can tell the audience, we at Best Care we basically has what we call the full package, where the priority is our patient. That's why we see first with the well-being of a patient. This is what we do at Best Care. So we do everything possible to provide the best quality care to our patients. That's why we basically every day we wake up and want to be better, so we can provide this kind of care for our patients. That's also the reason why we try to have everything at our clinics. For example,
Yes.
not only we do primary care, we have our labs on site. We do EKGs there. We go see our
Nice.
patient at home, but
Love it.
also we have everything else. We have people that want to do your aesthetics, people that want to do Botox, people that want to
Thank
do
you.
IV therapies, people that again, if you want to do the functional part of the functional medicine part. So we have all these things in one roof for you.
Thank you.
So we want the audience to know that at Best Care
Excellent.
we waiting for them, and
And please give us the number again if anybody wants to reach you.
if they want to reach us in Lehigh, it's 239-288-0840.
Wonderful. Thank you so much, Dr. Lewis. I look forward to meeting you one day, and definitely we'll have you back on the show. Thank you so much. Have a great evening.
Thank you very much. It was a
Take
pleasure.
care. Absolutely.